Hi, thanks for joining me for another video from Counselor Tips. In this video, I am going to be covering a counselor's virtual presence. Although there is plenty of research citing as to what is the most effective technique, theory, tool in working with clients, over and over, research shows the interaction with the counselor is cited by the client as being the highest driver of success in the counseling relationship. So even though our presence and our attentiveness and our education and all the tools that we're using with the client are really important, we have to remember multiple things while providing telehealth, because our presence is like this on a camera, through a phone, through the computer. It's more difficult to work with clients in this venue if you're not familiar with it, and it can feel tremendously intimidating not only to the counselors but also to the clients. So in this video, I am going to run through multiple things you need to keep in mind while providing telehealth to clients. So hang in there, because we're going to cover a lot of information in this video, but hopefully you can check boxes, feel pretty secure, have that self-efficacy, and remain fully present for your clients. That's what the whole point of counseling is, right? Focus less on the equipment and more being there for the client. You want to make sure that you keep your virtual office space free of clutter. What clients can see is what's around me. They don't need to be distracted on what's behind me. In addition, the virtual space with regards to what's filling the camera. And don't forget that even if your sound is off, your picture's still available to them. Before you get going, you want to check the field of view that the patient will be seeing. And that can easily be done by opening the program or platform you're going to be using, turn the camera on, and look to see what's around you or behind you. It's best to sit in a chair and sit upright. Please don't sit in a chair or on a couch where you potentially will be slouched. Please don't lay back on the couch. And for goodness sakes, do not sit or lay in a bed to provide counseling. So just think about how odd it would be that a client is attending a session and you're sitting or laying in bed. That's a no-no. Don't do it. Have your virtual office space be a representation of what you would provide in person. Being professionally prepared. Okay, so first and foremost, please do not be late to your counseling appointments. Make sure you schedule enough time in between appointments that you can take care of the documentation, go to the restroom, get something else to drink, or whatever it may be. If you have to be late, let the client know. Simply just send them a message. If you're using a telehealth platform that has a waiting room, you will also have a message board so you can let the client know, I'm sorry, I'm just going to be a few minutes late. Please wait for me and I will get to you as soon as I'm ready. If you do not communicate with them, think about how anxious this makes a person feel. If they were coming to your office and they arrived and the door was locked at their appointment time, that would create a whole lot of anxiety. So virtually, that's what it looks like when a client shows up at their appointment time and you're not there. It's like your door is locked. If you were going to be late to your office or had to run out for some reason, you might put a sign in the window that says, be back in a few minutes, please wait on me. So the same thing's going to happen virtually. In addition, before you start your appointment, you're going to want to review the client's case file. You wouldn't be reviewing the client's case file while they're sitting with you in session. You would briefly look over the last case note or anything else that you've documented to glance over what happened the last time, or if they're new, what you're anticipating this time in order to be ready for their session. If you're going to review homework with the client, that is, you gave them something to do the last time, then make sure you know what that is before they arrive. Homework is most effective when you follow up. In the line of professionalism, make sure that you check yourself prior to your appointment. So I don't have a beard. Kind of happy I don't have a beard. I have enough hair. But if you wear a beard, check yourself for saving things for later on your face. Check your teeth. Are they clean? If you just had lunch, that could be problematic. Scrub yourself up. If you need to powder up, you're too shiny, or wash your face or your hands, take care of that before the appointment. Please don't eat or snack during a telehealth appointment. Drinking is fine. You might want a little water or tea or coffee. You would be doing that in session anyway, and so a client may also be drinking. If the client eats, it's not your business. Just continue to work with them, and for goodness sakes, don't chew gum while in session. If you have a swivel chair, don't swivel. I'm in a swivel chair. You would have never known that until I told you. So if you can't help yourself, that's fine. Just change chairs. Dress for success. It's recommended when you have a telehealth appointment to wear a professional shirt that's light in color with no pattern. Although pinstripe or a nice pleasing pattern might be wonderful in person, on video it can seem very nauseating and disruptive or disturbing to a client. Try not to wear anything outside of solid colors, but be mindful that really bright colors like really bright red or fuchsia or like Technicolor yellow are too much on camera and can be overwhelming. In addition, although I don't wear a tie, some gentlemen may want to wear a tie. Remember to keep a simple pattern, but don't wear pinstripes or something that's too busy or too bright. You want it to remain as neutral as possible. In addition, gentlemen or ladies wearing a lot of jewelry, especially in the camera area around the neck, or big earrings or too much glitter, things that make noise where earrings are jingling, necklaces are jingling, or bangles are jingling. These are things that you want to avoid. So we don't want a lot of shiny, no glitter. Keep your makeup to a minimum. Don't put glitter on your face. It's too distractive, especially during a telehealth appointment. And you want the clients to keep the focus on the reason they're with you, not distracted by shiny. And although you will be filling up the entire screen, it's imperative that you want to keep in mind that while wearing a shirt, you will want the shirt to be a higher neck cut, not a low cut shirt, because it can appear that you have no clothing on. Don't wear spaghetti straps or a halter. Make sure that your shoulders are covered. So even if you're working from a home office, remember you're working at an office. So dress the same way you would as going into the office. When working with clients, you want to remember that even though you're providing telehealth, you're going to engage them in the same way. That means keeping eye contact. That means leaning in when they're telling you something very important. Also using the minimal encouragers that you're accustomed to using. So that way the client knows that we're fully engaged in listening. Remember that when you're providing telehealth, you will want to smile, change your affect. You will want to speak more slowly. Use your facial expressions to communicate exactly what you want to say to them. And your gestures, even though you're keeping them simple, they're congruent with what the client is sharing or you're sharing. Remember, you want to pause after you are done speaking because there can be lag time based on the client's internet connection or yours. And so you want to have a way for the client to know that you're done. That way you two are not talking on top of one another, right, and missing each other's messages. I do have a client that has a very slow internet connection, and so what we agreed to is to use the word stop when we're done talking. So I'll share with the client, and then I'll say stop, And the client knows once they've heard me that I've said stop, then it is their turn to share. So it's a lot of negotiating the connection and the reception, as well as how to communicate with one another to stay on track in the session. If you have to in some way turn away, or you have looked away, narrate to the client what's happening. So my home office has a window, and if somebody walks by the window, I may look because I see it out of the corner of my eye. I let the client know, I'm sorry, I was just, checking out who had walked by the window because I caught it out of the corner of my eye. There have been times that the server is down and I'm having to take hand notes of an intake or the intake session, and if I drop a pin, then on the floor, suddenly I'm gone out of the picture, but you can hear me. So we want to communicate with the clients why I have stepped away from the screen or turned away from the screen so they can feel that their level of confidentiality is being honored. And you also want to check in with the client after the session, especially after the first session, and ask them how telehealth has been working for them. If telehealth has worked well for them, then you can get feedback about what they liked or what they thought could be better. It's important to engage the client right away in the virtual session so that they feel comfortable. When we're asking the client each time that we meet with them, how was the virtual session or the telehealth appointment, we're engaging them in their treatment. Clients feel more invested when they're able to have their input solicited. And lastly, when you're closing out a virtual session or a telehealth session with a client, you want to make sure a few things are covered. So first and foremost, you either provide them with a summary of the appointment or ask them to provide you with a summary of the appointment. You want to make sure that you've scheduled the next session time with them and that they have documented that session time on their calendar as well. If you are giving a referral, you want to verify the client has written their referral information down, or if you've sent it via electronic messenger, text message, or email, that they have received that information. And you want to make sure that you cover their homework with them and email them any documents they need for homework, or that they have documented or taken pictures of the whiteboard that you may be sharing with them about the homework they've been asked to complete. Thank you for joining me on the virtual presence video. I certainly hope you found this video helpful, like a little checklist to check off before you get going, so that your virtual sessions are a success, all the way from equipment to your presence in them. If you found this video to be helpful and you think you're learning from Counselor Tips, please consider subscribing to this channel and turn on the bell. That way you know when I have a new video that can support you. If you found that this video on virtual presence was helpful to you and you think you know another counselor or mental health provider that could benefit from it, please don't keep it to yourself. Share it with them. That way they can get caught up to speed and provide virtual sessions in the most successful way possible. See you soon.